Here, general stromal hydration is performed to seal the incision. The cornea is inflated by injecting BSS at both ends of the wound to seal the main wound. As shown in this, when more BSS is injected from both sides to block the center of the main wound, there may be more corneal swelling. Also, there may be leaking when the center of the main wound is not blocked well. Zigzag stromal hydration is recommended to overcome these shortcomings. Zigzag stromal hydration is a method that inflates both ends of the main wound. However, the amount of BSS injected is less than that of general stromal hydration. Then, move needle sideways, left and right repeatedly at the middle of the main wound in a zigzag while injecting small amounts of BSS. Put simply, it looks like the following figure. Compared to the general method, this method allows you to inject less BSS into one spot than the general method and seals the wound all the way to the middle of the main incision. It reduces the possibility of leakage, thereby reducing the risk of complications of hypotonic states, such as endophthalamus. In addition, let's see how to get rid of the air in the eye during stromal hydration. There are lots of air bubbles in the eye. Ask the patient to look at their nose. Then the pupil moves to the other side of the main wound and the air in the eye rises upward. This makes it easier to remove the air by injecting BSS during stromal hydration. Next, let's see when BSS is injected into different locations during stromal hydration. BSS was injected in between the stroma and Bowman's layer, resulting in corneal swelling. However, you don't have to worry because the cornea will recover within 2 to 3 days. This patient's cornea is swollen because the BSS is injected between the stroma and the Descemet's membrane, not the stroma. Looking at this, corneal wrinkles and detachment of Descemet's membrane occurred. This is solved by injecting air and pressing on the Descemet's membrane.